Okay, hi, welcome to our webinar. We are with Dr. Tom Tolley for Ask the Vet, and welcome, Dr. Tolley. Hey there.
Hello, Laura,
Yes.
from warm, sunny South Louisiana.
Is it hot there? Is it really
Well,
toasty?
it's been a relatively cool and rainy summer here. So far, it's been much cooler than it's been in Seattle, which is unusual
Yeah.
for the summer. But nonetheless, it's still nice and humid to keep our skin nice and supple. But nonetheless, no, it's catching up and just starting.
Yeah. I'm in California and it's actually a really nice day today, but the heat, you never know. Next week could be like 100.
Yeah.
That reminds me, like, because I've been trying to, drink more water. Like how often, like, let's say it's really hot and your bird is dunking in the dish, how often should you be paying attention to the water dish? Like, should you
Uh,
be changing that water more often, or?
yeah, you should make sure that the bird has water, and of course, I'm a big fan of the Lixit bottles, or something where the bird, as we described before, the poop soup,
Yeah.
to try to reduce that. And then also the bottles reduce the chance of the bird getting in the water and dumping it all out or bathing in the water, and then you don't have any. But nonetheless, you should be checking that on a daily basis to make sure that it's it's clean
Yeah.
and full if you have the water.
So when you're like rehabbing like hawks and I don't know, wild birds, like, do they dunk themselves in like the water? Like, do they try to cool off?
Not
Are they
usually.
like, where am I? And this is like a foreign.
We provide water, but they get a lot of their water in their food,
Okay.
and then also if and when they come in, we do provide fluid therapy. I believe that fluid therapy, just based on observation of hydration, and we talk about being hydrated all the time, especially in the summer, and when you're exercising, to maintain hydration, and you really don't know if you're dehydrated or not. You just may start feeling a little lightheaded or something of that nature. But the one thing that I found is that by providing fluid therapy, the birds react very quickly,
Mhm.
and just because they feel better, their body can function better if they're hydrated. And what we find is that that the birds will look better, but we can't, in depending on what they are presented for or what disease condition they have, that just because they look better doesn't mean that they will continue to respond.
Okay.
Because they just feel better, they're going to look better, and it says like, oh, it's looking better, so things are, it's going to recover or it's going to get better. Not necessarily. It's good. That's a positive result, but it doesn't necessarily mean or equate to that the bird is just going to progressively get better, because they can initially have um, uh, they may appear that they are, and because they just feel good,
Yeah.
but it could be temporary once even with hydration, but initially they just do.
Wow. Yeah, I feel for the you mentioned the Pacific Northwest, like Seattle area. I feel for all the wild birds out there that they're not, I hoping they can find some water sources because it's scorching
Mm.
hot. I mean, yeah.
Yes, but no, fluid providing water and maintaining hydration status for the birds. And as I always say, our parents, and birds in general, they're more sensitive to heat than they are cold. And so this is when you want to make sure that if it is very warm outside, that the birds are not in the direct sunlight during that time period, or that, and this includes in the Gulf South, we have the temperature index. The temperature index is everywhere, but it's the humidity and the heat combined. And when you have a high humidity and a high environmental temperature, that makes it feel like it's hotter than it really is, because you're actually, as we do down here, we swim around in the environmental temperature, because the heat index, because the humidity could be 100%, literally at certain times, and so that you don't get condensation on your windows for nothing. So you want to make sure that during the summer that the birds are not getting too warm, because they can die very quickly. They have no way to dissipate that heat.
Wow. Okay. Wow. Well, that's a good thing to issue this time. I mean, with the heat stacking
Yeah.
up. If you're just joining us, we're at Ask the Vet with Dr. Tom Tolley. And I'm just going to remind everybody that if you do have a question, to use the Q&A feature so that we can capture it. So if you have a question, use the Q&A feature. And Dr. Tolley, I got a question for you. I'm going to read it off if you don't mind. We're going to jump into the webinar here. And okay, so this one is from Diane, who asks, who has a 22-year-old son, Conyer. And the past couple of years, he goes into a seizure whenever she takes him to the vet for a nail trim. So she's assuming this is stress related, and she wants to know, though, if she should worry about underlying disease. She says he's never had the seizures and started doing this when he turned around 17 years old. And it started when she would bring him into the bird store for a nail trim, and the seizures would kick in. So now she's saying when she takes him to the vet for nail trims, she has to cover the carrier until we're in the exam room and the vet is ready. And then the lights out seizure if the vet takes too long to do the trim or stresses him out too much in the towel. And screaming his name and putting him back in the carrier seems to bring him back around. So what is your take on that? It's an interesting reaction.
Well, my take is that it very well could be something that's causing the bird to seizure. But when you look at that, you look and say, well, is there any signs of disease other than this seizure activity? And when we're talking about signs of disease, that's runny nose, difficulty breathing, diarrhea, stool, not eating, depressed, anything where the bird is not acting normally. And if she's had it for this long, then there would be an understanding of what the normal behavior of the bird is. So let's say there's nothing there, and then that's where I always say, well, that's what you see on the outside of the bird, what's going on inside the bird. And that's why I always mention that's why we do the blood testing, because the blood will tell us what's going on in the bird for the most part. And then it's not going to tell you everything, but it's going to give you a wealth of information that you don't have just by looking at the bird. Okay. And if all of that comes back negative or normal, then it's going to be very difficult to say that there's anything specifically wrong through diagnostic testing if the bird is acting normally, other than when you take it in for this grooming procedure. Now, I'm aware of, this is one patient, and I know that there's other veterinarians can give you their stories, but there was a dog that if you took it into the veterinary clinic for an examination, it would start seizuring. through the front door. If you went through the front door of the veterinary clinic, it would start seizuring. So the owners always had to take the dog into around the back door, and the dog did not seizure. So it can be behavioral in a sense, and the bird is stressed out to the point that it does seizure, and that this is just doesn't do it any other time. The bird is normal otherwise. All of the diagnostic tests, blood tests that you've run are negative or normal, but when it goes in, it just like boing. And so it's like, well, what can I do? I need to do this procedure, but the one option you have is not, unless it is if it's a consideration on the bird's health. We have to do it because because I can't handle the bird. I can't. It just cuts my skin. It just makes it where it's extremely difficult. So unless it's an absolute necessary procedure to be performed, I don't believe it would be worth it to stress the bird to this point to do it. Now, if you have to do the procedure for whatever reason, then there are some options that you have there to try to reduce the bird stress level. One, as we did with this dog, and as it appears that you do with your bird, is to bring it where you have the cage covered. The bird doesn't really know where it is until voila, we're in the exam room. And then at that point, you can, there's sedation. You can sedate the bird to reduce the stress level on the bird during the procedure. And and also some of these sedative drugs have, I don't know if it's a proper term, but kind of provides an amnesia effect so the bird's like, well, what just happened? I don't remember, so there is some effect on some of this drug, and one of them's midazolam, and so there's also butorphanol that's used as a combination with midazolam, and that provides some pain relief, at least temporarily. And with nail trims, that's a painful procedure. There's no way you can get around it. We always give, even if we sedate the bird, we give meloxicam for that would be in effect. And meloxicam is an NSAID, non-steroidal anti-inflammatory drug. And it would be somewhat in the same class as an Advil or something like that. And so that kind of helps mitigate or the pain that would be there, any lingering pain for analgesic effect for maybe 24 hours. And then after that, it's not going, it should be fine. So all of that can help and aid in reducing the stress that the bird would possibly have. And of course, if it's seizuring in this, there would be some type of a memory effect on that well, I didn't really like that very, very much, or more than very much. And so I would say you really consider, does it really need to be done? And if it really needs to be done, then think about we would definitely look at sedation and making sure that there's pain management, analgesia following that.
Okay. Let's see. So Jane has a question about avian gastric yeast infection. Wants to know if a bird can be completely cleared of avian gastric yeast infection using a 30-day course of amphotericin B.
Amphotericin, that's good. You're getting good with that amphotericin.
I know. I gave it my all. Or will the infection keep reoccurring? Also wants to know, should the bird be in quarantine during treatment? And finally, Jane wants to know if you are familiar with the studies that the Schubot Exotic Bird Center is doing by Dr. Sharman Hops, confirming that sodium benzoate is an effective treatment. What are your thoughts on all that?
My thoughts, and these are my thoughts. There's a lot of questions in there, Laura,
There
kind
is.
of interspersed in the description there. I think the first question was that could you clear the organism on a 30-day treatment of amphotericin B?
Yes.
And I would say there are certain organisms, certain infections that in a number of animals, including humans, that I would say that you really never clear the organism, like it's not there. And I would say Aspergillus is one. I would say, and then also I would say Mycobacterium, if you treated a bird with avian TB, is another. And I would say Macrorhabdus ornithogaster is a third. So gastric yeast, avian gastric yeast, AGY, if you want to shorten that. So I would say no on that question. Now, what was there was sodium benzoate.
Oh, yeah.
I at this point, I think it's generally the consensus and is that it's not an effective means of treating avian gastric yeast. So not effective. I think that's what I would say is the general consensus at this time.
And then quarantine. Quarantine. She had a question about
quarantine.
Yeah.
Yeah. I would say quarantine would be anytime you're treating a bird with a specific illness. Quarantine is not bad. Like I said, there's no guarantee that you'll clear the organism with the treatment. And then you have to go, well, what's my definition of effective treatment? Is my definition of effective treatment, say, clearing the organism or the bird getting back to normal, quote unquote normal, that it starts getting weight, it appears to be, active and everything like it was before. And by all means, that could be the case, but you still haven't cleared the organism. The immune system, which is going to be 99% of what's going to be effective in reducing an infection that is subclinical, or if the bird's a carrier. Why is it a carrier and not infected? Well, in many cases, it's because the immune system keeps the organism at bay. It's only when the bird gets immunosuppressed by whatever means, it's stressed or reproductive activity or environmental or nutritional deficiency or something like that, that all of a sudden the bird gets ill because the organism's inside it and the immune system can't keep it at bay. It's not functioning as it should. And so, that's what we're looking at, and that's why it's so important. And we always stress to make sure that the bird gets very good nutrition and a good environment, so that the whole bird, as you would say, the yin and the yang, are all together, and that the bird is as healthy as it can be. And so if you have that, then your immune system is going to be functioning at the very best. That's why, in a developing immune system in younger birds, that's not, at its optimum. And in older birds, when they're worn out,
yeah,
that's why you know, that's why physicians or doctors, what's the primary patients they see? Do they primarily see 40-year-olds, 30-year-olds? No, they primarily see 70, 80-year-olds and the pediatricians with young children. That's because of the immune system, you see. It just and so that's what we're looking at here. And so you want to try to do everything you can. And so we get back to you know, your isolation, quarantine of the bird, and you want to make sure that the bird is getting the medication and it's not being stressed by its cage mates. And the one thing that you're looking at is that the bird, if it was with its cage mates before the diagnosis, they were exposed anyway. And it's hard to say which budgies, if you're talking about budgies, and in particular, which this is a common disease condition, but you also have a lot of passerines and everything like that. That this it's not solely a budgie disease, but they're subclinical carriers within this whole budgie, you know, cage environment. And so they're all passing it around, the young birds, the old birds. And then so you finally see one that's not doing well. Oh, it's got gastric yeast. Now should I separate it and quarantine it so the other ones don't get it? Well, they've already been exposed, you know. But it's no reason to continue to expose them. But mainly the quarantine, I would feel, is going to be to help that bird that's sick get better while it's on treatment. And so if you quarantine them, I mean, that would be a reason to quarantine more than anything, although you don't want to re-expose. But as soon as you put that bird back in the cage, the other birds have it, and there's very likely, if they're feeding each other or whatever, they're passing it back to them, said, oh, well, you've been gone, and here, have a little bit more gastric yeast since you've been treated. You know, so yeah. So it's kind of a, you know, so it's more complicated than just saying, you know, quarantine so you're not, and most people say, well, you're going to quarantine them, and think about that as, you know, I'm quarantining so the other birds don't get sick. But it's a little bit more involved in that.
That's that's an interesting take on that. I would never realize that. To protect them from themselves and from their flock mates.
Exactly.
So our next question. So Helena has a question about weight management for birds, for the parrots. So she wants to know
for everybody.
Yes.
Birds and humans.
There are some common takeaways, yeah. Right?
Get them on the treadmill.
If you have a birdie treadmill, then you have to share that with us sometime because we want to see it if you develop that. She wants to know, do you have any advice on how to feed a parrot who easily gets overweight? So she's talking about her blue-headed Pyonis who loves food. And she says currently, I currently weigh their pellets. She gets 13 grams of pellets a day. And she tries to go for a low brand that's low in fat. And then the Pyonis also gets vegetables each day and sometimes fruit. Twice a week, she gets sunflower seeds as treats, and when she trains her, and she has weighed as much as 330 grams. And what she's heard is that the blue-headed Pyonis their weight range should be more like 230 to 270 grams. Her current weight is 312 grams. Mm-hmm. So I guess, is that overweight, and what can she do to help?
Well, we've talked about it before, but it always is good to kind of get an idea. There's body condition scores in birds, and for the flighted birds, the body condition score is usually based on the pectoral muscles, and the pectoral muscles are your chest muscles, and it's the breast muscles on birds. So if you think about a Thanksgiving turkey, just picture a Thanksgiving turkey, either cooked or uncooked, it doesn't matter. And think about it laying there on its back with the breast out. Now, if you look at it, you'll see that the breast muscles are large, and they go all the way up to where the keel bone is, the sternum in the bird, and part of it, and and you'll see it's rounded. It's rounded, and it may be a little bit more rounded because they want to condition these birds get as much meat on them as possible, much muscle. And so that would be a very good bird in probably an over body condition, okay, where it's like, it's coming out and it's from the keel. Now, that if you think of a Thanksgiving turkey or a bird that's overweight, think of that. It's good. The chest muscles or breast muscles will be coming out of that. Now, the keel bone is in the middle, and it's kind of a sail on the sternum, and it's attachment of the breast muscle there that they use for flight. Okay. Now, if you just see that keel bone and it's very thin and there's like no muscle on it of significance, then that would be a bird that would be in the very, very poor body condition. Okay, very thin bird, very poor body condition, not very healthy whatsoever. So those are the ranges. The very thin, like knife, there's no muscle at all, to the Thanksgiving turkey. And somewhere in between is the optimum body condition score. Now, what you can do is you can feel that muscling on the chest of that Pyonis. And I would think that a Pyonis that's over 300 grams is going to feel more like that Thanksgiving turkey. I would think. That's a pretty large Pyonis. And so, that is a concern, but it seems like you're very well, you're very knowledgeable on the nutritional aspect of trying to do what you can without starving the bird, which I don't recommend. The problem that you always are faced with when you're talking about weight or weight management, and this is for humans too, there's a magic diet to lose weight. There's a magic diet, but nobody will promote it. Okay, it's simple: less caloric intake, more exercise. That will result in weight loss. I guarantee it. But who wants to eat less and who wants to exercise more? Nobody, right? And so therefore, the guaranteed weight loss recommendation or magic, is not promoted. But so that's the same with the birds. But you don't want to starve the birds, and you want to provide them nutrition, but they are not getting exercise. And so some birds can go fine. The majority of them are not prone to becoming overweight or reducing their longevity as far as their expected lifespan. And in fact, with the nutrition we're providing and the care that everyone's providing, birds are living much longer than what would be expected in the wild. But there are certain species and there are certain individuals, just like any animal, that are more susceptible to weight gain. And unfortunately, all you can do is provide an adequate diet, and if and there's very little as far as look at different things that may try to get the bird a little bit more active, and that would be what you can do. But it's difficult if the individual is predisposed or susceptible to weight gain, to reduce that by diet alone. Oh, you can't do it. You can't do it. All you can do is kind of manage it a little bit.
Okay. And so Dr. Tully, what do you have any like top 2 exercises maybe to try to, if you were going to?
Oh, I have flight. I mean, if you can get the bird to and I mean, it's if the bird is flighted, you always have to remember that if you have a flighted bird, that and well, if you have a flighted bird, there's always a chance that the bird could fly into a ceiling fan that's going, and injure itself, fly into the window or fly away. But that's a risk, and you have to try to reduce that. You can try to and so you have to be careful with that. But if you can get the bird to fly from one place to another, and start that, and it's just like laps, swimming laps, running laps, flying laps. So there you go. And that is that's where you're actually getting some I guess a caloric burn, and also
I know that sometimes people do that, they get the bird to do the wing flapping by having it perched on their arm and then kind of gently bringing their arm down.
I mean, anything.
Anything that gets movement.
And you can do that if the feathers are trimmed to reduce flight, restrict flight. So there you go.
All right, so then let's see, we have a question about a 30-year-old Nandi conure. So from SG, that's has a 30-year-old Nandi conure who has uveitis. I hope I said that right.
What's that?
Uveitis.
Uveitis.
Yes, thank you. Uveitis.
Mm-hmm.
Yes, I need to get my uveitis. The vet said it can be either acute or chronic in older birds. And how often is a chronic condition in your experience? They say their bird is very good, except for very good for his eye drops, but it would still be nice not to have to use them. So,
yeah,
eye drops in a bird, that would be interesting.
Oh no, yeah, we do that quite often. Yeah.
I can't even do one of my.
Sometimes it's easier to give than receive, Laura.
That's right. Absolutely.
So we're talking old birds, right? So there you go. So have to commend the owner for getting the little conure to 30 years. That's great. The one thing about the uveitis, it at 30 years, it may be caused by lens opacity, cataracts, and if when you're talking about chronic, usually it's divided. A disease condition can be called. It could be even subdivided, but generally the main 2 categories you have are acute, which is something that occurs within a short period of time, and chronic, which occurs over a long period of time and can continue to occur. Now, what range of days or time period is acute versus chronic? Most of the time, an acute isn't going to be over a week or something like that, but it's very subjective, and so but chronic, most people, it's like well, it's for a period of time, months, years, it could be, and even weeks, but usually not days. That's kind of into the acute. So like I said, if it's over a week, it's usually not acute, or if it's in somewhat of a no man's land, 3 weeks, 2 weeks, it's not acute, it's not chronic. But nonetheless, so this has been occurring for some time, and possibly caused by some of the ocular changes, changes within the eye that's occurred due to its older age. And so the uveitis, the treatments, and so the treatments are going to be somewhat dependent, because it's inflammation of internal structures within the eye, is going to be what's causing that. And so there's a possibility of whatever is causing that inflammation, and you're putting the eye drops in to reduce the inflammation, that the cause will go away as the bird gets older, and whatever the disease process that's causing it, matures and or stops. And that's a possibility. And if it's lens related, and something to look forward to as a possibility, but it may continue for an undisclosed choice.
Okay.
Or time period, it may continue. And so just continue to apply that medication as your veterinarian, who it appears is doing a fantastic job in assessing that, states, because it will make the bird feel a lot better, because as everybody knows, when you're involving the eye, it can be painful.
Oh, wow. Okay. This next question comes from Dr. Soga. What blood test analysis do you use when checking the bird's liver function? They say that they usually check the TBA and GOT, but is it necessary or meaningful to check the ammonia as well? They want your thoughts on that.
Well, usually for what we do and try to assess, because that's an excellent question, because with a lot of birds that come in that may have liver issues, what we'll see if there's any type of we'll have multiple conditions occurring. The birds may have be losing weight or have lost weight to a great degree, may have different conditions that affect, that contribute to some of the enzyme levels that you see, or you try to look at as it relates to the liver. So when we're looking for the liver itself to see possibly a disease condition in the liver, then what we normally, our tests that we look at there to assess the liver and condition is bile acid test, to look for liver function. So bile acid test is what we normally use to assess liver function in our birds.
Okay. Okay, next question is from Sadna. I hope I pronounced that right. Which treatment do you recommend for cloacal prolapse? Can you use sugar to treat the prolapse, or is it better to gently push it back into place?
Well, what treatment do I recommend for cloacal prolapse?
Yes.
I would prefer not to see them.
That's true.
That
How
is
common are they? I mean, they're unfortunately kind of common, right?
yeah, they're all too, you know, there's that I guess description of not uncommon. I like that kind of two negatives there. It's not uncommon, and they're very, very difficult to address because a lot of times it's hormonal in nature. I feel that is kind of a predisposition to the prolapse, and then once the prolapse starts to occur, you have tissue damage, and then it just makes it easier to prolapse, and and um, and so and African grays and cockatoos are probably the birds that we see the most often with this. And so what is my recommendation? And so the question was sugar versus just pushing them back in. Well, it's again dependent on how bad they are. And when you say, well, what do you mean by how bad? How bad they are? Well, it kind of is it something that has been prolapsed for a period of time, and then somebody goes, well, can't you see the the vent and the cloaca is out? Not really, because how does a bird sit? A bird sits on a perch and the tail is over it. And what's it hiding? It's hiding all of the, and so depending on how often you get the bird out, how busy you are, what you're seeing, you could go a day or two and it's been prolapsed and not see it because of just how the bird sits and hides that area. But but if in treating it, and of course reducing it and putting it back in is key. Now, if the tissue is inflamed and there's is swollen, what we call edematous, and then what you can and we have used dextrose, which is sugar, to try to reduce the size of the prolapse tissue, so we can replace it. Now, yes, replacing it is good, but you have to remember that the bird is pushing it out. Okay, and so you can put it back in, and then it's like, well, you can put it in, I can push it out. So it's push, pull, push, or, it's so push it in, push it out, so what's going to try to, then you have to think about trying to keep it in. And then the underlying aspect of that is to try to determine what's causing it. So yes, we use a sugar solution to try to reduce, and it usually reduces the size of that prolapse tissue so that it will go in to be replaced easier. And that means that yes, we also replace that tissue, because if it's exposed to the environment on the outside, that environment is going to not be helpful for the health of that tissue, and it can dry out, and it can become they can irritate that tissue. It could become it can bleed, and then it just complicates the whole healing process. That's initially, and then we try to maintain it in place, knowing that the bird is pushing. And so what is our main goal? To try to figure out what's going on there, because a prolapse cloaca, if you do not figure out or treat why the prolapse is occurring, then what happens is the bird will continue to push. And no matter what you do, it will eventually prolapse again.
Okay.
That's the bottom line with cloacal prolapses. And so we can treat to try to do everything that we can put it in, I mean, to keep it in. You know, you can put a purse string suture around and tighten it up, and you're not coming out, you know, but the bird can't poop anyway. And then it's going to die of toxicity, right? And so then you have to try to figure out what you can do to try to keep it in, have the bird, you know, be able to function normally in that manner, and hopefully, you know, treat whatever the problem is. And then when we're talking about hormonal, if we believe it's hormonal, then we utilize hormonal treatments like the Deslorelin implants. We've tried. Sometimes we feel it's effective, but they're expensive, and they may be effective for, you say, oh, it's working great. It's working great for a month and a half. And then it's like, oh, it's out again, you know, and then nobody can afford to pay $200, $300 for an implant, you know, 6 times a year, you know.
So, Dr. Tully, with prolapses, is that something that a bird owner could potentially deal with at home if it's happening frequently, or is that something that's always needs to be addressed by in a vet visit?
Well, because one, the bird will continue to do it. Meaning if you try to treat at the house, you can reduce it. You can put it back in, but the bird's going to push it back out. You can you know, push it back in, but the bird's going to push it back out. In most cases, and what you can, you know, what an owner can do is say, all right, it came out, and let me put it back in and see what happens. And if it doesn't come out, well, that's fine. But if you put it back in and you see it come back out, then it's going to need to be treated. And in some of the cases, and there has been the development of different surgical techniques to reduce the size of the vent opening, and that would cause it to you know, keep it in. But you have to remember that the bird is like, and we've had birds like going vocalizing, straining to prolapse that cloaca. And that's and so and a prolapse cloaca is something that, for the most part, unless you treat the underlying cause, as I mentioned, it'll continue to happen. And you can possibly get lucky, and like I said, you could reduce it yourself, but in the end, I think in the majority, you know, the 99% of the cases, they're going to reprolapse.
Okay. And let's talk briefly about the sugar, because that's fascinating. Like, why sugar, and how does it help? Like, what is, like, who thought of that? How'd you come up with the sugar fix?
It's an osmotic effect on the tissue to reduce and draw out some of the fluid to that and reduce the size of that. It's an osmotic effect on the tissue.
Wow. I just never heard of sugar as a therapy of any. I mean, that's fascinating.
Yeah.
All right.
Honey, yes, I guess, but sugar, no. Right. Honey
That's
for
right.
wound treatment, right?
Yeah. Yeah. Oh, that's fascinating. Okay. And then
Yeah,
so,
but it's an osmotic effect to draw out some of the fluid. So yeah.
all right. All right. Kim wants to know if she can give her parrot juices like cherry juice, cherry juice. Like, can she freeze it in ice cube trays for those hot days? Is that a good idea? It's not sugar juice, but pure juice, like pure cherry juice. As like,
Yeah, I don't
nice.
see anything wrong with that. You know, And again, it's just would be something that would be part of the diversified offerings that you have to the bird. Just I'm sure that if they enjoy it, that they will find that it's a different taste, a different texture. It's cold, I mean, it's just part of that psychological stimulus that nutritionally it's not going to be significant, because again, most fruits are sugars, right? But at the same time, you're looking at providing an overall stimulating environment for the bird that tastes good. Not saying that any of the ice creams or that we eat are good for us, but they don't hurt.
It'd be refreshing, that's for certain.
No, so that's great. There's nothing wrong with that at all. Yeah.
Right. And Helena had a question about preventing diarrhea in parrots, specifically cockatiel. So she has a male cockatiel and a female cockatiel that live together in an aviary. The male's fine all the time, but the female, she has periods of what she would refer to as diarrhea. So very watery poop with the green part being loose. Just trying to figure out what connect these periods with anything in her food or environment, hormonal period. So she's saying it just seems like she's very sensitive to being prone to having diarrhea. And
Well, one of the what you could look at is that this is where, if the stool is abnormal, this is where you look and see if there's anything that may be what's the underlying cause. And with this diarrhea, it could be anything from the bird. This is normal for the bird to have these type of this type of stool, or it could be an underlying disease condition. Now, what I'm hearing, and is this what you gathered, Laura, is that this is intermittent, that sometimes it will be and then sometimes it isn't?
yeah, I said that the female has periods of what she would refer to as diarrhea.
Yeah. And so the one thing that always when there's a change in the stool, this is why it's always important that I always mention to our owners that they look at the stool when they first get the birds to determine what's normal for the bird. Because if it's abnormal, and the first question that I always ask with if the stool's abnormal, well, what are you feeding the bird? So during these periods of diarrhea, is the diet changing at all? And to correspond to the loose stool. And then also looking at it as it's where in the period of time does this correlate? If this bird is reproductively active, does this go in the reproduction cycle? And so you look at that to try to see if you could get any correlation with that. And then if not, then you go into a situation of trying to test. And because then it's well, it could be a parasite that is not causing a what I would consider a condition that's continuous. Okay, you have intermittent, and so you would check for any type of gastrointestinal parasites, and then also culture for any type of bacteria that may be causing intermittent diarrhea, and to again a CBC, a complete blood count, to try to determine if there's any inflammation that may be occurring, possibly due to a bacterial infection and to kind of get the overall general idea of what the bird's condition is inside. That's how you would go about trying to identify what this cause is, but it would go in those steps to the point where you can try to incorporate what is actually going on with the bird. And so you have intermittent diarrhea, and that's when you're looking at this is occurring. What's the bird's weight? What's the body condition? Because you can get intermittent diarrhea, and what's the bird's overall general behavior? Is it eating normally? Is it behaving normally? Because when you start getting and you start thinking about diarrhea in certain cases, then there's all different forms of or all different disease conditions that can cause it, that can cause diarrhea. But many of the disease conditions that, or if you say, well, it's got diarrhea, there's other issues going on with the bird. It's just not intermittent diarrhea. And so, the bird's thin, the bird may have neurologic signs that, it's not intermittent, so there's other, the bird's not active. So there's all, different presentations for different disease conditions that can cause it. But if if it's intermittent, something like this, it may be where the bird's immune system can function enough. If it's a parasite or bacteria, it could be related to some of the other things that I mentioned. But it is a process to go through to try to determine it. But there are diagnostic tests out there to try to help to identify. I'm not going to say will identify, but help to try to identify what it is.
All right. Let's see. A couple questions for you towards probably our last couple questions here. Real quick is so one person wanted to know if offering electrolytes in hot weather is a good idea to help facilitate replenishing lost electrolytes. So even on an intermittent basis, like time, even as time, let's say like stressful times, like mentioned earlier, and the prolapse, would electrolytes help with those? Would it help during hot weather, during stressful times?
Yeah, for the most part, when you're talking about that, I would say good fresh water is the best with good nutrition, and make sure that that's offered. That would be my recommendation. When you start talking about electrolytes, that's a great question. As always, we've had excellent questions today. Thank you very much. Fantastic. But when you're talking about electrolytes, think of anything electrolyte that is made for humans. For instance, has anybody ever tasted Pedialyte, which is recommended? It's not the most palatable product on the market, but it works well to hydrate you and provide electrolyte. And then, of course, you have all of your sports drinks that are, where do they fit into the electrolyte? They taste good in a sense if you like that, but others don't. So you run into, and birds are no matter what they say, and I mean, if you've owned a bird, you know that they have very good taste. Birds can taste very well, and sometimes I think that the bird's taste buds are at the tip of the tongue. When they touch something, it's like, I like it or I don't. And it's very quick. And so I just have a feeling that although that it would be something that someone would feel would be a good idea, and for all the reasons that that mentioned, um, that the birds would not be amenable to tasting that. And I don't, and as far as the prolapse is concerned, I don't think the electrolytes are going to help one way or the other.
Okay.
But I don't think the birds would be amenable to drinking or electrolyte solution. That's why if we do something like that, we have to give it under the skin or through IV catheters or intraosseous catheters.
Wow. All right. And then this final question is about giving a parrot apple cider vinegar on a weekly or monthly basis.
I don't have any really, and that's a good question, because I know that it's been kind of promoted and over throughout the avian world, let's just say. But the only when I provide information through these question and answers, I always try to give information that's either evidence-based, where there's been scientific results that can verify what I'm stating, or that I have seen where it's the cases over the 35 years that, I've seen that and I've treated with that and it works or it doesn't work or what have you. The apple cider vinegar, I have no, there's no evidence-based information that it is effective or not. With the number of people that have given it, it appears that birds aren't dying left and right due to giving it. So, but I don't have any thoughts on the apple cider vinegar until I get more information as it would relate to it. But it's an excellent question, because I know that it's being promoted, and that's usually how we do our research. We see something that people are recommending, and we say, well, let's do some research and see if it really does what they say it does. Is it effective? And based on what I don't know, Laura, but it appears that it's the best thing since sliced bread, and it'll take care of just a number of things. But and then that's somewhat difficult to do research on, because then what you're trying to do is prove that it is either effective in doing that or not, and that's sometimes difficult to quantify objectively on that. But I guess with people doing it and the animals not dying, it doesn't appear to hurt them, but we just don't know that.
All right. Well, that's a good take on that. And that, believe it or not, is our last question that we have time for today. So thank you, Dr. Tolle. And before I just real quick, I was going to get to what we have. Our next webinar is going to be July 30th, next Friday, with Dr. Susan Arose. And she's going to cover avian bornavirus, the common signs, treatments, updates. So you want to tune in, find out everything that's going on with that. And
well, that's fantastic. That's fantastic. And I want to thank you, Laura and Brenda and Lefebvre, for providing this forum for us to talk, and all of our participants. And also I want to say that this weekend, if you're on the Gulf Coast in Mobile, the South Alabama Bird Club is having their expo. So, if you're in that lovely part of the country, I'm sure that they'd love to see you there.
Oh, that's awesome. What a nice shout out. That's good. Thank you. And, I think just seeing all the messages pop up, Dr. Tolle, everyone totally appreciates your time answer these questions. It's like, I can't even, where else, I mean, where else can you get this? This is awesome. So
Yeah.
once again, and we get you back in August. So you guys get to tune in, see Dr. Tolle next, towards the middle, end of August, for Ask the Vet, another session of us.
Well, I thank everybody, and again, Lefebvre, is responsible for putting this together, and y'all are all great, and I look forward to seeing you in August before we have our big conference, our scientific conference, and learn more things to try to keep these little birds happy, healthy, and live a long time.
That is, better words could not have been said. And so, speaking of our sponsor, today's winner for our product giveaway is Adam R. So congratulations, Adam. And I'm going to try this. Hopefully it works. Screen share time. A video from our Lefebvre sponsor here for, we're going to send out some Avi cakes your way, Adam, and also another Lefebvre product of your bird's choice. So here we go. I'm going to screen share this video. Hopefully it plays. This is what AviCakes is all about. Let's go. Let's see. Okay. Hopefully you guys can see that. And that. All right. Here we go. I'm going to play some AviCakes here. All right. That looks good enough to eat. I'm getting kind of hungry because I want to snack on some AviCakes right now.
Well, it looks to me that that it has been improved upon, the AviCakes. It's kind of a newer product.
Yeah, it looks. There you go. In all sizes. There you go. All right, hope that worked. Hope everyone saw that, the better screen share. Last time I didn't play, but there you go. On that note, I'm gonna wish everyone a very happy weekend, and happy weekend, Dr. Tolle.
Yes.
And all the best to everyone, and all the best to you and your flock. And until next time, everybody be safe. Bye.
Thank you. Bye-bye.